I grew up in the Caulfield, Bakersfield area. I leave every week, go to California and come back. Sometimes I wonder why, but it's about all I've ever known. Hello. In all honesty, the day I walked in here, Doc Roberts, his exact words, "You ready to go to hospital?" I'm like, "What?" I mean, what do you mean go to hospital? They showed me my blood pressure and it was extremely high. He said, "You're at stroke level." And like I said, they've literally saved my life. There's no other way to put it, because the time that has lapsed now from where my blood pressure at, I would probably already be dead. And when they told me they was closing, today was the last day that's going to be open, I like, oh my gosh. Just like somebody walk up and slap you upside the head is what it felt like when they told me. It's like, okay, now what am I going to do?
It was Dr. Roberts' dream the whole time I worked with him that he wanted to start a free clinic. And it came to fruition in 2004.
It was born in the heart of Dr. Roberts as he saw patients in his private practice that weren't receiving timely care or were not picking up prescriptions at the pharmacy because they didn't have enough money to pay out of pocket. But a lot of them needed to be on maintenance medication, whether it was for hypertension or diabetes or COPD. He has always been a kind of person that thinks outside the box.
And in a couple of weeks, I talked to several people, including the hospital administrator and the pastor of the church, what they thought about a free clinic. And everybody said, "I think we can do it." So that was the beginning of the Good Samaritan Care Clinic. We may live in the poorest area in the state, one of the poorest areas in the United States, but it's really good people.
I think one of the important things is that we do have Sherry who is paid, but everybody else is a volunteer here. That people come from all persuasions to help, and that's a heartwarming thing.
22 medical providers, and we'll probably have another 60 providers from front desk, housekeeping, nurses out there.
In this whole state of Missouri, there's just a handful of free and charitable clinics. So, here we are in this little southern rural Missouri, in a small town of about 2,500. Not a lot of big business to help finance a clinic of this nature. So the fact that we've been able to pull this off for 17 and a half years is quite remarkable.
And tonight is our last clinic after 18 years and 36,000 visits. We're going to be closing the free clinic tonight.
Whether you are on the Medicaid expansion or not, you still are going through those same types of thoughts and, how am I going to pay for my medicines at full price and the doctors and the blood work and the x-rays and so on and so forth. And not only that, you can't find people as compassionate and caring.
I think some of our patients are feeling a little bewildered and lost, for lack of a better word, especially those that have applied for Medicaid but haven't heard anything back yet. A lot of them have relied on us for many, many years, and so we really have become more like a family than just a medical provider. And so they consider this their medical home, and it's like they've lost their home.
It'd be hard to find a doctor like him. He's a true country doctor. He came back to his roots.